Hey everyone, this is Erika Crossley with A Perfect Fit. So, I just wanted to share a little bit of information with you guys. I just got off the phone with one of my clients. I've actually been working with her for a while. I love her. Just this cute little old lady that completely reminds me of my grandmother. Just lovey and feisty and funny, and she is very independent to be in her 80s. She still goes for her walks. She goes out to have wine lunches with her friends. She is very active in her church. So I was a little alarmed when I received her phone call because I actually helped to place her sister into assisted living. And when she called me, she didn't sound like herself, and I learned that she was at Methodist. She just finished her surgeries because she was at home quarantining, and she rolled out her garbage can, and then boom, she fell, fractured her hip and her knee. So right now she's at Methodist, and she's looking at what her best options should be because she doesn't want the same situation that happened to her sister to happen to her. So her sister was very independent, just like she is, and they went on their walks together, things like that. And she ended up needing hip replacement, but from getting her therapy to having muscle atrophy because she was in the bed for so long, not being able to tolerate therapy, she just got weaker and weaker and weaker, and therefore independent to bed bound to depression, and then unfortunately she ended up passing away. So her concern is, how do I prevent that from happening? And then how do I prevent that from happening with the addition of not getting infected with COVID-19? So I just wanted to go over some notes that I took earlier today because I know that elective surgeries are allowed to resume. So we're going to start to see an increase in knee and hip replacements and discharges from the hospital with people that need rehab. Okay, so if let's say you have a mom or a grandmother who needs to go into a rehab facility and you desire the optimum results, you have two options. The first is inpatient rehab, in which this client has to be able to tolerate at least 15 hours of therapy per week. So 3 hours per day, spread out throughout the course of the day, 5 days a week. And then the second would be in a nursing home. So let's take a nursing home because they've been in the news a lot lately, and a lot of people have the concern with going into a nursing home and COVID-19. So what should you do? The first thing that you should do is definitely pre-qualify where you're going to go prior to surgery. So we're not talking in a situation where it's an unfortunate accident in which you fall and you need to go be admitted into the hospital for emergent surgery. We're talking of the situation where this thing is planned and you know that rehab is inevitable. So what should you do? Because you can't go to do the tours and you don't want to leave it up to the hospitals at this point to just determine where you go. So first thing to consider is every rehab is not accepting clients at this moment. There are a lot of rehabs actually that are halting admissions, or you have to have they have to take additional protocols in order to accept you. So I know of one where you have to test negative for COVID-19 at the hospital. I know of another where you have to have nurses notes where they're showing that you don't have any respiratory distress, that you're not infected with COVID-19, you don't have a temperature and things like that. So first find who is accepted, or consider the fact that there are some communities that are not accepting clients. Now, how do you find these communities? I recommend going to I think it's medicare.gov/nursing home compare. And they will be able to tell you based off of whatever your demographic information, such as location that you need to put in, which communities are rated the best, which is 5-star, and one rated definitely, absolutely do not pick that community. Okay, so once you've narrowed down from nursing home compare the 2 or 3 communities that you're interested in, call to see if they're accepting clients. call to see what their qualification process is, such as, do you have to test negative at the hospital, or will they be able to provide a test for you upon admission? Now, keep in mind, regardless of where you go, the inpatient facility or the skilled nursing facility, you're going to have to self-quarantine for 14 days, regardless. Okay? So think about that. You're in rehab for rehab and you have to isolate for 14 days. How do you get rehab? Right? What does that look like? So you've picked your community. They've told you have to test negative, yada, yada, yada. You go into the community. You're finally admitted into the community. And now you're self-quarantined for 14 days, but you still have this hip problem that caused you to be here in the first place. What does it look like? Do I go to the gym for my therapy? Is therapy closed? Do I self-quarantine therapy? Meaning, does the therapist come into me and just 6 feet away say, raise your leg? And how does it work? Do they bring the equipment into me? Is the equipment sanitized? Do I have to? So there's just so many different things that you have to ask prior to just picking a community, because they're accepting clients right now and your insurance is accepted at that community. So you have to dig a little bit deeper to figure out, what does it look like when I get there, and will I achieve the outcomes that I'm looking for? And you should definitely ask them, what is the outcome versus for me getting therapy in my room bedside, with or without the interaction of a therapist, versus me getting rehab in a gym. And if those odds aren't favorable, if you can, you might want to consider delaying your surgery until a later date. So we've already discussed doing the virtual tours, seeing if you qualify for even being admitted into the rehab facility based off of their admission protocol. Now you've determined if you're going to go into inpatient rehab or nursing home. So what's next? What other questions do you have? Do you ask them? You definitely ask them if they have positive cases of COVID-19 in the community. Let me be very transparent. There are a lot of COVID-19 cases in the senior living communities at the moment. And just because one community has a COVID-19 case does not mean that you will get to their community and it will be transmitted to you. A lot of them have infection protocols in place. They have isolation wings and things like that. But those are the questions that you should ask. How many cases do you have? How many staff members are infected residents? And what are you doing to protect your staff and your residents, i.e. me, from being infected with COVID-19? Because if I have to test negative in order to be admitted into your community, I want to test negative on the way out of your community too. So what are you going to do to protect me? And how do I get my proper nursing care, my CNA care, my therapy care without contracting the virus? Okay, so you should definitely ask those questions. You most certainly should ask about their capacity for PPE. Now, I will tell you, as an insider in the industry, you have some companies that are saying that they have more than enough PPE, and you have nurses and CNAs that are like, they want me to continue to reuse my own mask. And some people I know are bringing gloves. Okay, I don't really necessarily know how you're going to determine the accuracy of that, but I do recommend that you supply your own PPE. If you know well in advance that you're going to be transitioning into a rehab, at least what you can do is defend yourself. Okay, I would ask them about the staff shortages and if they have any, because you have to understand, we just went through a period in which admissions from the hospital decreased, therefore census decreased, therefore there weren't a huge need for staff members. So some people in some companies or buildings might have laid some people off or furloughed them, but as new admissions continue to flow in, that doesn't necessarily mean that they're going to have enough staff for the census load. Okay, so you do want to ask about the staffing shortages and if there are any, just to be on the safe side, to make sure that you're in a very well-staffed environment so that you're not waiting 2 hours for someone to come answer a call light. Okay. We've already discussed how you're going to do your therapy and what questions to ask, how you're going to protect yourself, and how the facility will protect you. One question that she did ask, and I thought this was a phenomenal question: who's going to do who's going to do the laundry? I mean, are we all doing our laundry together? Because now, what is the protocol? What if I want my family to do my laundry instead? How do we arrange that? Right? So those are questions that I definitely feel like you should ask, because now normally it would be okay for the community to do it, but we're dealing with something that we're not prepared for. So there are additional practices that should be in place to reduce the rate of infection. And so I thought that was a phenomenal question. Now, she had questions in regards to her family that lives out of town, because she lives here alone. What are some of the ways in which they can reach out to her? So I started to think about one of the clients that I placed recently. She actually she's pleasantly confused. She has a little bit of dementia and a cell phone. She loses it all the time, but the family is very much so concerned because they're in San Antonio. So if you know that you're gonna, or your loved one, you or your loved one is going to go into a rehab community, I would definitely get the communication protocol in place. So let's just take the pleasantly confused lady, where a cell phone isn't necessarily good for her. She does not isolate well because she's used to a routine and things like that, and she can get agitated fairly easily. Do you leave a cell phone at the nurse's station or with the DON so you can FaceTime at a certain time, per day? Or how does that work? How do you ensure that the person who is pleasantly forgetful is also being protected by not, touching doorknobs and wandering out the room all the time and things like that? So those are just simple things that I would consider when you are talking about placing someone in a rehab facility right now, and you're a family that wants to be involved and wants to oversee, but because you can't visit right now, those are some of the hurdles that you'll have to go through with our new normal. Okay. And I do recommend doing whatever it takes to make yourself comfortable. I do know in some communities they allow cameras. I don't know. That's just something that you would have to discuss beforehand. And then finally, once you have transitioned from the hospital to rehab, what is the best environment for you post rehab? And let's just assume that coronavirus, the situation is the same way that it is right now. Are you comfortable with caregivers coming into your home? Are you comfortable with living with someone else to help you to do your bathing and your grooming and your toileting, and also in feeding, right? Because you can't stand up on this very weak hip and cook full meals and things like that. So what environment do you go to in order to ensure that you're in a safe environment in which you don't re-injure yourself and readmit back into the hospital? So, and it could, like I said, it can be with going homes with caregivers, with family members. It can also be going into an assisted living community, a memory care, or an independent living community. The memory care and the assisted living has the most overall caregiver support that would be included in your monthly bill. So all of your meals will be included, your caregiving services will be included, and then you would also be able to receive home health in your unit. Now, mind you, once again, you have to self-quarantine for 14 days, self-isolate. Once again, if you discharge into an assisted living, memory care, or an independent living. So I would pick wisely what home health company that you choose, and I would ask them the same questions that we just talked about. How are you going to protect yourself? How are you going to protect me? How are you going to rehab me? Is it going to be an interaction with one another? Is the equipment sanitized? How does this work, and how do you help me reach my total goals? So I hope that this was helpful. I know it was very helpful to me when we had this conversation, and I just know that we're going to come across a lot of these needs in the near future. So if you have any questions about anything, you can reach me. My email is info@apfsle.com. Thank you guys.